Do you sometimes notice that even a small bump leaves a big bruise? Or maybe a small cut takes much longer than usual to stop bleeding? If yes, it might be more than just bad luck. These could be signs that something important is missing in your blood. One rare condition like this is called hemophilia B. Imagine your blood is like a car brake system. When you get hurt, your body needs to hit the brakes on bleeding. A special protein called factor IX is one of the key parts that helps stop bleeding. In hemophilia B, the body doesn't make enough of this protein. So the brakes don't work well, and bleeding can last longer. It mostly affects males and is usually noticed in childhood. Think of it like having a toolbox full of tools, but missing a very specific wrench. Everything else works. But without it, the job doesn't get done. Great question. It's caused by a mistake in the body's instruction book, your genes. Specifically, a problem in the F9 gene, which tells your body how to make factor IX. Most people with hemophilia B are born with it. It's like receiving a phone with a tiny fault in the software that no one knew about during manufacturing. This faulty gene is usually passed from parent to child. Often, the mother carries the gene but doesn't have the disease, like a messenger who passes a note without reading it. This is why it mostly shows up in sons. Sometimes, though, there's no family history, and the gene changes happen randomly, like a typo in a text message. In all cases, the body makes too little or no working factor IX at all. How do you know if someone might have hemophilia B? Let's play detective. Signs usually appear early, especially in boys. Have you ever seen a baby get a small head bump and later develop a big swollen bruise? That might be a clue. Bleeding after vaccinations, dental work, or minor cuts can go on longer than normal. Some people bleed into joints, like knees or elbows, which causes pain, swelling, and trouble moving. It's like water slowly leaking into a door hinge, making it stiff and sore. Others might bleed from the nose often, or after a simple thing like brushing teeth. In serious cases, bleeding can happen even without injury, like internal bleeding in muscles or organs. The more severe the deficiency, the earlier and worse the symptoms. So frequent, long-lasting, or internal bleeding with little or no cause, that's a red flag. How do doctors find out if it's hemophilia B? Let's say you go to the clinic after a small cut bleeds for hours. The doctor won't guess, they'll test your blood. First, they check how fast your blood clots with tests like PTT, kind of like timing how fast a puddle dries. If it's slow, they dig deeper. Next, they measure the level of factor IX. Low levels mean hemophilia B. There are 3 levels: mild, moderate, and severe. Mild might need treatment only during surgery. Severe might need regular care. The main treatment, replacing the missing protein. Patients get infusions of factor IX concentrate, like refilling the missing wrench in your toolbox. This can be done at a clinic or even at home. For minor bleeds, fast treatment stops damage. Some people get regular prophylactic doses to prevent bleeds, like putting a raincoat on before the storm hits. Newer treatments also include drugs that help blood clot in other ways. Can we prevent hemophilia B? Well, since it's a genetic condition, we can't change the genes yet, but we can plan ahead. If a family knows they carry the faulty gene, couples can talk to a genetic counselor, kind of like a guide who explains the odds. Think of it like checking a car's history before buying, so you know what to expect. Pregnant women with a family history can get tests like amniocentesis to check if the baby has the condition. While we can't prevent the gene problem yet, we can prevent serious bleeds. Avoiding injury, using protective gear during sports, and stopping certain medications like aspirin, which thins blood, are smart steps. Vaccinations for hepatitis are also important since frequent blood treatments carry small risks. Education and early treatment plans are powerful tools. Prevention isn't just about stopping disease, but stopping damage too. Is there new hope for better treatment? Yes, science is moving fast. Imagine a future where a single treatment could fix the faulty gene. That's gene therapy. Recent studies have tested giving patients a working copy of the F9 gene using harmless viruses as delivery trucks. Early results show some people making their own factor IX for years after one treatment. It's like upgrading the phone's software to fix the bug permanently. One drug, called etranacogene dezaparvovec, was approved recently. Patients went from needing regular infusions to making nearly normal levels of factor IX. Other advances include longer-lasting factor IX products, fewer infusions, better life. While not a complete cure yet, these advances mean people with hemophilia B could one day live without constant worry of bleeding. Exciting, right?